Acupuncture 101 class. My name is Xiao. I'm a licensed acupuncturist and I'm also a faculty of University of East-West Medicine. Acupuncture is originated from China. It has been used for treatment of various diseases for over 3,000 years. So, what is acupuncture? Acupuncture is the insertion of needles into the skin, while the therapeutic effect is expected to come primarily from the act of inserting, manipulating, and/or returning the needles in specific locations. While acupuncture points may be stimulated by a variety of methods by acupuncture practitioners: needling, moxibustion, cupping, manual pressure, electrical stimulation, laser stimulation, magnets, plum blossom, bleeding, and injection therapies, among others. When the primary effect is expected from the act of inserting the needle itself, this is acupuncture. How acupuncture works. Traditional Chinese medicine is based on an ancient philosophy that describes the universe and the body in terms of two opposing forces, yin and yang. When yin and yang forces are in balance, the energy, qi, flows through meridians or pathways in the human body. These meridians and energy flows are accessible through more than 361 acupuncture points in the body. Traditional Chinese medicine view the body and the mind as nothing but the forms of qi. Qi is one of the vital substances, and it is the basis of all. Disruption of the qi flow can cause disease. Inserting needles into these acupuncture points may help to bring the energy flow back into proper balance. Modern research has demonstrated acupuncture's effects on the nervous system, endocrine and immune systems, cardiovascular systems, and digestive systems. By stimulating the body's various systems, acupuncture can help to resolve pain and improve sleep, digestive function, and sense of well-being. To understand how acupuncture works, we need to understand the concept of qi and de qi. According to ancient Chinese philosophy, qi was the fundamental substance constituting the universe, and all phenomena were produced by the changes and movement of qi. Qi in Chinese medicine denotes both the essential substances of the human body, which maintain its vital activities, and the functional activities of body organs and tissues. The arrival of qi is called de qi, or the needling reaction. Acupuncture treatment does not take effect until de qi achieved. The signs of de qi seems a fish bites on fishing rod pulling the line downward. When the patient feels soreness, numbness, tingling, heaviness, and distension around the point, or their transmission upward and downward along the meridian, it is a sign of arrival of qi. Concept of yin and yang. Yin and yang represent the opposite but complementary qualities. Each thing or phenomenon could be both itself and its contrary. Moreover, yin contains the seed of yang, so that yin can transform into yang and vice versa. In Huangdi Lei Jin, Huangdi said, "The law of yin and yang is the natural order of the universe, the foundation of all things, mother of all changes, the root of life and death. In healing, one must grasp the root of the disharmony, which is always subject to the law of yin and yang." Concepts of five elements. The theory of yin-yang and the theory of five elements, also called wuxing, constitutes the basis of Chinese medical theory. Wuxing contains wood, fire, earth, metal, water. Each of the elements has its own basic qualities and movements, and corresponding to seasonal cycles. Wood is corresponding to spring, fire corresponding to summer, earth corresponding to no season, metal corresponding to autumn, water corresponding to winter. 5-element sequences. The generating sequence: wood generates fire, fire generates earth, earth generates metal, metal generates water, water generates wood. The controlling and the overacting sequence, both are the same sequence. The controlling is physiological sequence and the overacting is pathological sequence. Wood controls earth, earth controls water, water controls fire, fire controls metal, metal controls wood. The insulting sequence. It takes place in a reverse order to the controlling sequence. Wood insulting metal, metal insulting fire, fire insulting water, water insulting earth, earth insulting wood. Meridians and acupuncture points. There are 12 main acupuncture meridians and 2 extraordinary meridians. There are total 361 acupuncture points on these 14 meridians, 40 extra points plus many acid points spread all over our body. To learn more detailed acupuncture points location, please go to the following website: https://acupunctureproducts.com/acupuncture_meridians.html. Acupuncture needling technique. Insertion. Needle must be inserted into body with right hand and assisted by the left hand. In the process of insertion, angle and depth are at most important. Correct angle and depth help to induce needling sensation, bring about the desired therapeutic results, and guarantee safety. Lifting and thrusting, turning or rotating are 2 basic needling manipulation methods. Returning, hold the needle in place after it is inserted to a given depth below the skin. Withdraw, press skin around the point with thumb and index finger of the pressing hand. Rotate the needle gently and lift it slowly to the subcutaneous level. Then withdraw it quickly and press the punctured point for a while to prevent the bleeding. Applying appropriate needling technique according to disease nature can result in reinforcing or reducing effects. Reinforcing is more for the deficiency syndrome. The method can invigorate the body resistance and strengthen and weaken the physiological function. Reducing is more for the excess syndrome. The method can eliminate the pathogenic factor and harmonize the hyperactive physiological functions. There are 2 comprehensive needling techniques, which is setting the mountain on fire. This method is derived from reinforcing procedures. Penetrating heaven coolness. This method is derived from reducing procedures. Acupuncture side effects. The most common adverse events associated with acupuncture are needle site bleeding, superficial hematoma, and needle-site pain. Less frequently, fainting due to acupuncture tiredness, aggravation of symptoms, and a broken needle are reported. Other practice issues are stuck needle and forgotten needle. Acupuncture for pain management. Most patients with pain symptoms rely heavily on over-the-counter or prescription painkillers, which may induce safety and addiction critical issues. From a traditional Chinese medicine view, pain is caused by the meridians being blocked. This symptom could be caused by various diseases. Acupuncture has been practiced in China for over 3,000 years to treat pain because it is safer and has fewer side effects. Many research studies have demonstrated that acupuncture can help to relieve pain by releasing endorphins, the body's natural pain-killing chemicals, and by affecting a part of the brain that governs serotonin, a brain chemical involved with mood. Acupuncture for mental health. Anxiety disorders are one of the most common mental health diseases. The conventional treatment for anxiety disorders, such as pharmacology and psychotherapy, present limited efficacy and adverse side effects. Many clinical research studies have concluded that acupuncture can be used to treat anxiety disorders without significant adverse effects.